Hello everyone. Today we will talk about cardiac tamponade. Cardiac tamponade is defined as the compression of the heart by accumulation of fluid in the pericardial space. In this image of the heart, this thin black line is the pericardial space surrounding the heart. In tamponade, due to fluid accumulation in this space, the heart is compressed. Tamponade can occur as a result of any process that causes pericarditis, which is the inflammation of pericardium. It can result from the following: malignant diseases, most commonly lung cancer, infections such as HIV, some bacterial infections including TB, and some fungal infections as well, trauma to the chest, post-operative pericarditis after a cardiovascular surgery, post-myocardial infarction, which includes Dressler syndrome in which the pericardium is injured, and also post-MI, wall of the left ventricle gets weak and it can rupture, so the blood from the ventricle will leak into the pericardial space. Similarly, in aortic dissection, there is a tear in the aorta which will leak the blood into the pericardial space. Some connective tissue diseases like rheumatoid arthritis, SLE, etc. Certain drugs like hydralazine, procainamide, and isoniazid can also cause pericarditis. Then there is uremia and hypothyroidism. And if we don't find any cause, then it's called idiopathic pericarditis. Before going into pathophysiology, let's revise the normal events of blood flow through the heart quickly. The heart receives deoxygenated blood from the superior vena cava and inferior vena cava from the upper and lower parts of the body, respectively. This deoxygenated blood is drained into the right atrium. Right atrium contracts and fills the right ventricle. The right ventricle will then send the blood to the lungs through pulmonary artery. In the lungs, the blood gets oxygenated and it is sent back to the heart in the left atrium through pulmonary veins. This blood is then flowed into left ventricle and finally into aorta and its branches, from where it is circulated throughout the body. So this is a heart. I know the heart doesn't look like this, but just to make things simple, we'll assume it this way. These are the four chambers of the heart: right atrium, right ventricle, left atrium, and left ventricle. Veins drain deoxygenated blood into the right atrium, and left ventricle drains oxygenated blood into the aorta. This is the pericardial space surrounding the heart, and it is filled with a lot of fluid inside. So this large amount of fluid in the pericardial space will start compressing the heart, right? So the heart is being compressed and it has become smaller. Initially, the right ventricle is compressed more because it is thin-walled as compared to the left ventricle. However, later the left ventricle will be squeezed more because the right ventricle will push it from the right side and the fluid in the pericardial space will push it from the left side. So what will happen once the heart is compressed? It's simple. The smaller the heart, the lower the volume of blood in it, right? To make things more easy, here's a simple flow chart explaining the pathophysiology of cardiac tamponade. Keep in mind the normal events of blood flow in the heart. So generally we know now that the heart has been squeezed, it's smaller, so the volume of blood in the heart is decreased, right? So here's the pericardial effusion, which will compress the right ventricle. The diastolic filling of the right ventricle is decreased. The outflow of blood from the right ventricle to the pulmonary artery is also decreased. The volume of blood reaching to the lungs from pulmonary artery is also decreased. This decreased volume of blood will come back to the left atrium and then left ventricle. And finally, the left ventricle will pump only a very small amount of blood into the aorta. This is called stroke volume. and then overall the volume of blood that is being pumped out by the heart is decreased, which is cardiac output. Remember, cardiac output is the product of stroke volume and heart rate. Now that you know the pathophysiology, it's simple to understand the signs and symptoms of cardiac tamponade. Beck's triad refers to hypotension, distended neck veins and increased jugular venous pressure, and muffled heart sounds. Hypotension is because the cardiac output is decreased, so obviously the blood pressure will be low. Distended neck veins is because now that the heart is smaller, the intracardiac pressure is higher. So the heart will not be able to receive the blood from the veins normally, due to which the blood will backflow into the neck veins. So you will see that the neck veins are distended. Muffled or distant heart sounds is because there is a layer of fluid between the heart and chest wall, so heart sounds are softer when auscultated with stethoscope. The patient will have compensatory tachycardia. Remember that cardiac output is the product of stroke volume and heart rate. So because the stroke volume is decreased, the heart rate will increase in order to compensate for the lower cardiac output. The hands and feet of the patient will be cold from low cardiac output because the perfusion of the distant extremities is decreased. Pulsus paradoxus is also one of the indicators of cardiac tamponade, which means that the systolic blood pressure drops more than 12 millimeters of mercury during inspiration as compared to expiration. When you look at the patient, they will not look well. They will be drowsy, fatigued, agitated. They might even complain of syncope. Also, there can be pleuritic chest pain due to pericarditis. The diagnosis of cardiac tamponade is clinical. There is no single test that can diagnose cardiac tamponade. So basically, it is a combination of clinical suspicion and diagnostic tests. Chest X-ray findings may show cardiomegaly, a water bottle-shaped heart, pericardial calcifications, or evidence of a chest wall trauma. ECG will show low voltages, and you will find electrical alternance, which is alternation of QRS complex amplitude. This is because the heart is swinging from the fluid surrounding it. Echocardiogram can also help in the further assessment of a patient with cardiac tamponade. Normally, this is how the echocardiogram looks. This is the right ventricle, left ventricle, right atrium, left atrium. In echocardiogram, just flip the heart. You will see ventricles above the atriums. Okay? In cardiac tamponade, what happens, like see all this black area is effusion. All of this is fluid. Okay? Due to which the right atrium, left atrium, they're all collapsed. Right ventricle is collapsed and the heart is swinging and the left ventricle is underfilled, due to which the cardiac output is decreased. Cardiac tamponade is a medical emergency that requires urgent intervention. Preferably, patients should be monitored in ICU. All patients should receive oxygen. We should expand their volume by giving blood, plasma, or isotonic sodium chloride solution as necessary to maintain the adequate intravascular volume. Bed rest with leg elevation may help increase the venous return. The definitive treatment of cardiac tamponade is urgent drainage of pericardial fluid, which is pericardiocentesis. A needle is inserted through the xiphoid process until it pierces the pericardial space and aspirates the fluid out. For patients with recurrent cardiac tamponade or pericardial effusion can undergo pericardial window. It is a surgical procedure in which the cardiothoracic surgeon cuts a hole in the pericardial membrane and inserts a catheter that can drain the pericardial fluid. That's it for today. I hope you liked the video. If you did, then don't forget to share it with your friends. Take care. God bless you all.